Hi everyone, my name's Brydie. I am the social media director for MedMentors, and I'm here today with Emma, who is our founder and president. And today we're going to run through a medical interview question about rural medicine, particularly commitment to rural practice. Today, I'm going to be the examiner and Emma's going to be our student. So the reason we've chosen Emma as our student today is because she is committed to rural practice. So Emma has done her clinical school at a rural clinical school, and she'll be doing her internship rurally as well. And then who knows after that, but probably more rurality. So Emma has all the answers.
Some medical schools might weight this type of question a bit heavier than others, but don't be surprised that it could come up at any school. Don't think that the school that you're interviewing at isn't considered a rural medical school and then not study around this topic or have some thoughts of your own about what would happen if you got a rural placement, because it's very likely that every medical school in Australia has some sort of rural pathway, rural stream, and will certainly be offering BMPs. So it's something that everybody should be looking at.
Absolutely. And the reality of medical school is that even if you manage to get through your whole medical school without going rurally once, which I don't actually think is possible, but perhaps it is, you will at some stage be doing a rural rotation, whether that's during internship or later on in your career as part of a specialty training program. So rural medicine is really important. And even if you end up working in metro hospitals, you'll still be seeing rural patients. So you need to have an appreciation of some of the challenges that they face. So without further ado, let's get stuck in. I'm looking forward to being the examiner today. Many medical schools offer special streams for students either from rural backgrounds or who commit to rural medical service. What benefits do these schemes offer?
Okay, so that's a really interesting question. So I guess my first thought would be that this is a good opportunity for people that live in rural areas to get into medical school, because I guess it's easier for people in metro areas to get into medical school. So it's really good to be giving those opportunities to people outside of metro areas as well. And I guess for the rural streams and rural placements, that is a good opportunity for these students to be able to practice medicine and maybe be closer to family during this time. They could go back to the rural area that they came from and continue studying medicine, which would be a great advantage for them as well. It might be harder for people in metropolitan areas to go to these rural areas if they were selected to go to these placements, because they would not have friends or family there. So that would probably be a challenge. I suppose other benefits would be just the exposure to rural areas in general. I'm sure many of us have not been to these areas, and it's good to see how different hospitals run things without all of the fancy machines that you might see in the big cities, and learn different strategies in that regard. Yeah.
You have a follow-up question. What are some healthcare challenges faced by rural communities?
So I guess some of the biggest healthcare problems in rural areas would be that they don't have access to the same things as people in bigger cities. So like I mentioned before, some of the fancier machines used for surgery procedures or for diagnostics might not be found in more remote areas. There also might not be as many doctors out there, so you might have to travel really far, and that can cause a lot of issues for people. And one of the other big problems, I think, in rural areas that we need to take into consideration is the Closing the Gap initiatives, because I know that in rural areas, we have a lot of our Aboriginal and Torres Strait Islander or First Nations people, and this is a contributing factor to the disparity in health and health outcomes. So that's something that we all need to be aware of and working towards as well as doctors.
How might these challenges be overcome?
So I suppose it would be too hard to move people from their rural areas when they're feeling unwell and needing treatment in bigger areas. So it would make more sense that we move more doctors out into rural areas so that they can get the treatment that they need. So doing this, I think the BMPs that are offered are a really good way of making sure that doctors are getting to these smaller areas and rural areas. They're designed so that more doctors will go out to these areas during their training or after their training, which is a really good initiative. I think other things that the government are doing are financial incentives, which is like increased pay or reducing stamp duty if you're going to buy a house in a rural area. And I know some rural doctors even get, they have their accommodation and bills and things paid for, which is all really great for doctors and encouraging them to go to these areas that are in need. And yeah.
Thank you, that's time.
So in this scenario, we were trying to emulate a pretty typical response for somebody that hasn't done a lot of research around the area and maybe isn't feeling very confident in articulating some of the challenges surrounding rural outcomes. One of the typical responses or openings to a response that a lot of us hear from our mentees is starting with, "That's a good question." We even do this as medical students when we get put on the spot sometimes. It's one of those automatic responses that we say, but it is, again, one of those sort of filler, time-wasting responses. You don't need to answer every question with "that's a good question," because obviously the person that wrote these stations is already thinking that, and it's just wasting your time. So try not to answer things with "that's a good question" or reiterating the question. Just try to dive straight into it if you can. It's really important as well to do a lot of research about the implications of a BMP. If you don't know what that is, that's a bonded medical school place, which is different to a Commonwealth supported place or CSP, in that you also sign a contract at the beginning of medical school to say that you'll commit to a return of service of X amount of years.
So as an examiner, it felt clear to me that this student was making a few assumptions about rural health and that they hadn't researched everything that they needed to. Their answer was very focused on either rural students staying rural or how we can benefit doctors going rurally, with no real consideration of individuals who will be impacted, such as rural communities, and also the possibility of metro students wanting to go rurally. So I felt as though there were a few assumptions, and it sort of shed rural health in a negative light, which is quite unfortunate because clinical schools want to hear that you're really interested in rural health. And if you haven't given it a go, you just don't know. Some of my rural health rotations have been the best rotations I've had, but one thing that's very obvious is when you do go to rural communities, they are underserviced. And so it's important to appreciate the complexity of that issue. As Emma identified, starting a response with "that's a good question" actually feels a little bit rude to the examiner. Of course, I think my question's good or I wouldn't have asked it. And if you continue this habit throughout medical school, you'll definitely get some consultants sassing you. Many medical schools offer special streams for students, either from rural backgrounds or who commit to rural medical service. What benefits do these schemes offer?
I suppose the primary point of these schemes is to address the maldistribution of healthcare services in rural areas. The density of healthcare concerns and the outcomes that we see there are often far worse than what we see in metropolitan cities. We see most doctors ending up doing their specialty training and laying down roots and starting a family in metropolitan areas, which is making it really hard for them to get back to a rural area. Even if they were rurally inclined to begin with, it is really difficult to pick up and go back. So to address problems like this, it is really good to give opportunities for young doctors and medical students early on to start laying down roots and finding mentors and meeting other people like-minded to them about rural healthcare, and trying to set up from the start your career in a rural area so you're more likely to stay and it's less difficult to have to pick up and move. So I think these schemes are really important in addressing things like that. I know that in Australia, the rural healthcare shortage is critical. In the next couple of years, it's looking like we're going to have chaos in a lot of small towns as their doctors are reaching retirement and they have nobody to give the keys to their practice to. We need to start really focusing on exciting young doctors in the prospects and the benefits of working in a rural area in the future. Some of those benefits can be better or more autonomy from a younger career perspective. You can do more, train in different areas compared to metropolitan counterparts. Many people say that their experience in a rural area was quite excelled compared to what you could be doing at that same point in your career in a metropolitan area when there's so many doctors around you that it might go to somebody more highly trained. So yeah, you can look after a lot of different presentations. You're really needed. It's really hands-on, as opposed to maybe doing more of the admin side of your job in a metropolitan area, which is one of the big benefits that a lot of young doctors really enjoy. Coming from a personal perspective, I suppose for me, I've also seen the benefit that it gives to a community. Living in a rural area when I was younger, my family had a lot of trouble holding on to a GP. We had a lot of people come in and come out, and they would change every few years. And the community in general became a little bit untrusting of new doctors. They got really sick of having to explain their situation over and over again from the start. They got sick of having to wait for long appointments because there was only one GP and it was really hard to make an appointment. So they would often just put up with things. And that resulted in a death in our community not too long ago because somebody just put up with a lot of their symptoms, and then they ended up having stage 4 pancreatic cancer, and they could have been diagnosed much earlier had they actually felt like they had the continuity of care that most people would get in a metropolitan area and seek help a little faster. So I think that having that continuity of care makes a huge difference in a community and is really important for everyone.
Great. You have a follow-up question. What are some healthcare challenges faced by rural communities?
So there are a lot of challenges for people living in a rural area accessing healthcare. Even the distance from a GP or a specialist can be quite challenging from a financial, travel, and even time perspective. We know that the total burden of disease in rural Australia is often 1.5 times higher than that of metro areas, which is pretty alarming. There's a higher rate of cardiovascular disease, of cancer. There's higher rates of critical injuries from road accidents and things like farming machines. There's a lower availability of fresh fruit and produce in some regional and remote areas, which can result in poorer nutrition, which again is another risk factor for many metabolic diseases. So it's a very complex situation with a lot of different things happening there.
So how might we overcome these challenges?
I think the rural access schemes are an excellent starting point. I think the government and medical schools initiatives here are definitely a step in the right direction already. I think that we still need further government funding to support these schemes even further and keep them going, and continuing to revise what is working and what's not working to make these schemes the best they possibly can be. And getting more feedback from those who have experienced the schemes and taking on their advice as well as more placements and training opportunities for those who are passionate about rural health in the first place, so that these people aren't sent to metropolitan areas because that's their only option in the future. Trying to make sure that they're easily streamlined into a rural area for their entire medical school and their entire training program would be fantastic.
Great, thank you. So from an examiner's point of view, I really liked Emma's response this time because firstly, we could see that she had a good idea of some of the challenges that face rural communities. Secondly, she actually told us a little bit about her personal experience growing up in a rural community, which is always nice to see. And thirdly, I got an impression that she was really passionate about rural health. It also showed that she had a good understanding of some of the programs medical schools have to get people into rural programs and why that's so important. I think a lot of students just assume that they won't have to go rurally or aren't interested in going rurally. And to me, that is just so off-putting as an examiner. I really want to see some passion about rural health and at least some knowledge of some of the barriers that are faced, because even if you work in a metropolitan hospital, you will be treating rural patients. Emma, over to you. You can tell us a little bit about how you felt answering that time.
Like everyone, it's a bit of a nerve-wracking experience, and your nerves are going to get to you no matter what. Even if you've practiced your answer a million times, you might go a little bit brain dead, but work through that. I think just trying to calm down and be real with your question. If you have any passion for any part of any question, try to get that through. Try to really give part of your personality and what you're interested in to the examiner, because that really comes through very well. I think more than ever, medical schools are really, really interested in finding people that have a genuine passion for rural medicine, because we are hitting a very critical time where we need rural doctors more than ever. So their ears are going to be pricked more than ever. So those of you that are genuinely interested in rural medicine, medicine, make sure that comes across strongly, because they need you. We all need you. All of the people in rural areas need you. So make sure it's really clear that that's something that you're interested in your interview.
Thank you for joining us for another little episode of what not to do in your MMI. We still have a few topics to go, so keep your eyes peeled. Once again, give us some suggestions if you've got any ideas, if you've got any questions, chuck them down below and we'll do our best to answer them. Make sure you visit our Instagram. We've got heaps of MMI tips there, including some about rural health. So please jump on and keep an eye out for the next video.
We'll see you next time.
Bye. What are sorry, I'm talking to myself.
I started recording again, so we have you going, what are the barriers?
And the reason we've selected Emma as the student today is she is committed to rural practice. She's done a medical school in...
Hey, Gomez. Yeah, good question. So I suppose...
Thank you, that's why I get paid the big bucks. Sorry. Don't put that in, Chris. Thank you. That's why I get paid the big bucks. That's why I get paid the big bucks. How might these challenges be overcome?
Yeah, okay, that's a really good question. And I suppose the more...
That's why I get paid the big bucks. Sorry, we need to get cracking. Sorry, last time. I was not fast. How might these challenges be overcome?
Yeah, okay. Yeah, that's a really good question. So I guess you can't even hold it together. Yeah, okay. Yeah, that's a really good question. So I suppose I would look at it. Damn it, I'm not even looking at you.
Can we just do How might these challenges be overcome?
I can't do it. Okay. Yeah, so that's a really good question. I think in the first